Did my speech on healthcare in the US. I'm going to start now. On average, a person in the United States spends more money on healthcare than any other person in other countries. By countries, I mean the Organization for Economic Cooperation and Development countries. These OECD countries consist of 34 countries that are fast developing and progressing. With more healthcare spending, we should expect that the healthcare in the US is the best. The US does have the best healthcare specialists, according to the Department for Professional Employees, but it has the least healthy citizens compared to the other OECD countries. On a different note, Costa Rica has an exceptional healthcare system. Every citizen in Costa Rica has health coverage and no bills are sent to patients. The US should change its healthcare system to be more like Costa Rica's. According to Chris Gilbert's article, Healthcare in Costa Rica has a universal healthcare system where all citizens are covered. It doesn't make a difference in coverage if a patient needs a lot of ongoing treatment or just a simple treatment. In the US, there is no universal healthcare coverage. According to DPE in 2014, 89.6% of the US population had some type of health insurance. This means that 32.9 million people were not covered in 2014 in the US. Costa Rican Health Services gets most of its funding from their government. It may be surprising to know that Costa Rica has not had any military since 1950. Since then, all of the government defense money is put into Costa Rica's health services. They also have more drinking water and better waste handling in 95% of their country. Because of the high healthcare costs in the US, people with low income are not getting seen by a doctor when they are sick, are not going to the dentist when they need to, and so on. Part of the reason the US has increased healthcare costs is because of common chronic diseases. These can include diabetes, obesity, and others. If healthcare costs were lower, or if everyone was covered, the chronic diseases in the US would decline because people would have more access to healthcare and be better informed about preventative measures. The only downsides to the healthcare in Costa Rica are the laws against abortion and the old buildings of the health facilities. Also, the lines for getting seen are very long in public hospitals. The laws against abortion in Costa Rica are a downside because even though there is evidence of an abnormal pregnancy, abortion is illegal. Still, there is evidence that the US should learn something from the Costa Rican health services. On one last note, the life expectancy of an average person in Costa Rica is 79.1 years, which is longer than the life expectancy of an average person in the US, that is 78.6 years. In conclusion, Costa Rica has a universal healthcare system, while the US has many different non-universal private healthcare systems. Everyone who is a citizen in Costa Rica is covered under the universal healthcare system, no matter what they need coverage for. In the US, about 90% of the population has some type of coverage, but that doesn't mean that they are covered for everything. All of the government defense funds went to the health services in Costa Rica, which helped with getting drinking water and better waste management. The preventative measures in Costa Rica exceed that of the US. Therefore, the future of the US healthcare should look to Costa Rica for reference.